All right, grasshoppers. Oh, here she is, back by popular demand. We missed her. People were just crying. They called me up. Where is she? Where is she? Wasn't here last week, but Allison is back. How you doing there, bud?
I'm great. I missed all of you guys too. It was busy last week. My husband's father was visiting. We hadn't seen him since a long time, since we were last on the East Coast.
Nice.
That was great.
Okay, just to be clear, if anybody does not know who Allison is, her husband, we'll start with him. He's and actually Memorial Day yesterday too. I forgot about that. Your husband serves in the Navy. He works on nuclear ships. Really intelligent, dedicated guy. He's done that for 20 years now. And Allie and I met through another member, a gentleman who used to be in the Navy, Bob Pizzini, who was coaching down in Virginia Beach. I got to know him on that Warrior for Life fund that I'm on. And so it's a lot of people doing a lot of great things for our country. And Allison is an epidemiologist by trade, abcmedicalwritings.com.
How about that? You got it.
Got it? Nice.
Yep.
Thank you very much. That was after 2 weeks too. Allison's also a great mother, works with the hockey program down there in Virginia Beach. That's how we got put together, and very knowledgeable about all the vaccines and pandemics and all that kinds of stuff. So how you doing? Things are good?
I'm good. Good. Yeah. Life is interesting. It's great. It's gorgeous out today. I'm really happy that people are starting to feel more comfortable going outside without their masks on and things like that. And vaccinations are, reaching more and more people. We have at least one dose in half of our country. I was actually just playing around with data in this fabulous website, ourworldanddata.org, and I was really interested to see that Mongolia has had an incredible vaccine uptake there too. So they're right up there with us in the UK. And Israel.
I'm probably going to put you on the spot here, ask you this question, but being from Canada, and actually one of our guys that does a show with us on Thursday, living in Canada, and they're way behind. There's only like 38 million people in the country, and they're way behind. And even when they get the first shot, in some cases, they've had to wait like 2 or 3 months before they can get the second shot. So is there a rationale for that, or?
Well, I was looking at that just yesterday too, because I'm like, when you're watching the NHL right now, you can see the American arenas, right, are full with, vaccinated sections and sections for unvaccinated people with more distancing. And then you look at the, I probably shouldn't even say this, for the poor Maple Leafs, they've come under a lot of fire. But you look at their game and the stands are empty. And so I was like, what's going on here? There's so much data all around all the time. You can't really keep up with it. So I just looked yesterday and it looks like Canada's cases are coming down just like ours. Their vaccination rates are a little bit behind, but cases are coming way down. But for everything I'm hearing and kind of anecdotally is people are really worried there. Playgrounds are still closed and things like that. So the restrictions are still really, really tight. People are hanging on for dear life to get through this third surge and are worried about a fourth surge and things. So I don't really epidemiologically, it's not horribly different from where we are. And Canada is really in a good place if they can continue to keep those vaccinations going into arms, and a delay between dose 1 and dose 2 is not the end of the world. I mean, we were talking about, CDC and FDA really wanted us to stay on track with dose 1, dose 2 at 21 days and 28 days. And I was kind of muting myself and not speaking thoughts out loud for a long time because I'm just a master's degree epidemiologist. I'm not a PhD. I'm just a mother, just a hockey mom, just somebody who's curious and trying to read and make sense of all this. But everything I've known about immunology for 20 years suggests that, the prime dose, the first exposure is what sets up immune memory. And then the second dose oftentimes is really just a boost, or it's to seroconvert the people who didn't respond the first time. It's like, hey, we need another one to kind of wake up that small fraction of people's immune systems that just didn't quite respond the first time. So, a longer time span between dose 1 and dose 2 should not have been a problem. They just didn't have the data to support that statement. But really, did we really need to go and prove that? The thing about the coronavirus pandemic is everything that we've known has been proven, and we are holding our breath until it's proven, to an extent that I don't believe we really have done before for other diseases. We're asking, the bar for proof is so much higher for this one. And we're just really, really, really risk averse. We're really worried professionally about saying something that could end up being only 80% right instead of 100% right. And I think that's pushing everyone into a place of overcaution. And I find I don't think that's really a healthy place to be,
Yeah, I agree. And you co-authored, you sent this to me, co-authored a news piece talking about getting kids back into school and the low rates that are going on, all that stuff now. Where can people find that? Where was that?
Right. So last week on the 26th, Washington Post, 4 of us co-authored what we thought was going to be just, a factual statement and appraisal as to where we are in the pandemic and looking forward ahead to fall and, summer and camps and things like that. So Monica Gandhi is an MD and MPH. She's an epidemiologist. And another friend of mine, Tracy Hoog, is a MD, PhD. She's an amazing, you would love her, Tom, ultra runner, marathoner, is out on trails running all the time, mother of 2 boys. And so she's amazing and just really detail oriented and really interested in providing reasonable guidance to people and, the real deal. And then another woman here on the East Coast, so that's the West Coast side of the little foursome that got together just spontaneously. And then on the East Coast in DC is Lucy McBride. She's an MD internist, and she really cares about the whole person. That's her entire vision, is to bring people into primary care and rebuild health, overall health, mental health, physical health, and the intersection between those two being so important. So the 4 of us got together, all mothers. Between us, we have 11 kids. And we just, we're trying to make sense of this. The others have been far more famous on Twitter than I have. I've really not been speaking up too much because I have real self-confidence issues. But my claim to fame has been real world, boots on the ground experience with this virus personally and in the hockey rink. And I think that started coming through the hockey season and working with Rich Appleby, our president for the association, and the rest of the head coaches and the parents and the team managers and the kids. Really gave me a sense of what this virus looks like in the real world, when it's given a chance to circulate. Who does it infect? Does it really infect? How fast does it move? Who gets really sick? We've had personal losses in our family. My own stepmom passed away. I've seen challenges with getting all of the evidence together regarding treatments and, misapplied treatments at the wrong time, given the right thing at the wrong time. It's just, I've had my kind of sleeves rolled up with this for a long time, and it just seemed time to speak up about where we are. And as we were talking backstage, just, it's this place of overcaution might have been useful very early on in the pandemic, but we're 15 months in now, and we need to help people move out of a place of fear and recalibrate risk and help them, figure out what is safe, by the data going forward. And if they're not quite comfortable with that, then the baby steps that get there, because everyone's going to move back into quote unquote normalcy at their own pace. And that's okay. It's not to push anybody. It's just to say, here's what we know.
Right. And to sum it up, and correct me if I'm wrong, I know there's a lot more details to it, but basically with kids especially, your position was then that they should be going back to school without masks. They're fine. The numbers show that it's no different. Even the hospitalizations are no different than the regular flu. In fact, are less at this point than the regular flu that we're used to all the time. Is that pretty correct?
That's a fair summary. I might try to take a stab at doing that one more time. But I will say that the article was only 800 words when it finally went to print. And what we had to say was worth every one of the 1,500 words that we drafted, right? So when you do an op-ed, it gets cut dramatically. And the editors did a wonderful job in the Washington Post. But there's always nuance that's missing that just doesn't come out until you have an actual conversation. But yeah, what we were trying to say is that, for kids, they are thankfully really, really low risk for coronavirus. Yes, we have lost somewhere between 300 and 400 children. The data is really hard to track. In some cases, it looks like deaths are being counted for COVID when actually they were incidental findings due to surveillance in the hospital for other things. Mm-hmm. And pulling the claims codes apart after the fact requires an actual look into the medical records to see what the cause of death truly was. So that's tricky. Are they being overestimated? Are they being underestimated because we weren't testing kids as often as we could have? Flu is underestimated, the CDC thinks, because not every death is fully ascribed to flu. So we might be underestimating flu by who knows how much. So the flu COVID comparison is one that I'm constantly forced to make, and I really don't like making it because the data is so challenging. The report, even the CDC has 2 different databases that we could pull from for deaths. One is really current, includes Puerto Rico and Guam and New York City, and the other one lags by 2 weeks. But maybe the data is more solid because they're looking at death certificates and certifying them, but the lag is long and it doesn't include the territory. So like either way, somebody is going to be mad at you for counting this or not counting that. So the flu COVID comparisons are really tough. But what I can say, and the data that is really solid and really interesting is done at a little bit smaller scale than these large school surveys and things, which are correlation and interesting. The surveys of, do masks work in school? Does distancing, does it really matter in school? And it's really hard to say definitively anything with those, except, it looks like they might help, but we're not sure how much, because those are self-reported cases and things. But the really good data that I was looking at yesterday, and for another piece that might be coming out in the future, is just what's happening in the child's body. Right. So if they have COVID in the nose, and you and I have talked about swabbing that nose a lot and what's going on in there and infection versus disease. So the children have less viral load in their nose, those CT levels, the actual number that you get when you get the swab from your nose. They're finally talking about CT levels in kids, and they actually have less viral load in their nose. And then when you take the viral particles out and you put them in a culture and you try to grow out virus that actually could infect someone, they're half as likely as adults to have infectious virus too. And, when you talk about the risk that we were just alluding to, kids going to the hospital, around 0.8% of kids who have COVID may go to the hospital. And that's all known cases. We're not testing all kids with COVID. So it's, and the thing that they're going to the hospital for can be very serious, the MIS-C, but it also does have treatments. The data just kept coming out, more and more data suggesting that the things we're really worried about with them are maybe not as huge a concern. Long COVID looks like possibly by 2 months out, most kids, 98% of kids, have cleared any symptoms of COVID, including fatigue. So do I have some long COVID issues? Yeah, maybe I do. I'm not saying long COVID doesn't exist. I have some weird stuff with my teeth, maybe some fatigue, maybe my, endurance is possibly not as great as it was, but so how much of that is psychological, right? And just putting two things together that may be unrelated. I'm also getting older.
No, you're a medical miracle. What are you talking about?
So I don't know. So Tom, I guess what I'm trying to say is, the four of us were like, we're seeing this data mounting evidence that kids are, thankfully really spared from the worst of COVID. And yet we're not measuring. So we're measuring everything regarding what's in their noses and things, right? But we're really not measuring what's happening in their lives. Like we're not able even to go into school and experience what school is like for them, for those kids who are in hybrid classes. If you're in a hybrid school and you really think about what it's like to be in school, it's great that the schools that have gone hybrid are letting them in, 2 days out of 4 a week or whatever. That's a wonderful start. The kids who are back in full school, it's great. They don't mind the mask. It's not about the mask. But it's about all of these rules and these restrictions and this hyper focus on, a sterile environment and be careful and this and that. And I honestly think that we're not measuring the anxiety that produces, where people can't live. And we've put people in houses, for a long period of time, for a year, and forced parents and kids, when kids are trying to gain independence and assert their independence and become their own people, right? We're forcing everyone to live together and work together in house in this environment, this microculture that's just not normal. And to think that doesn't cause anxiety for people, it would be ludicrous. And we're not measuring that.
Yeah. Well, it's just the whole thought that you're afraid of everything now. I know it's not everything, it's just a virus, but it makes kids feel like, well, I need to wash my hands. I need to sanitizer all the time. And I don't want kids getting sick, and I do agree they should wash their hands. But I grew up in an environment on the farm, for instance, where we never washed our hands. And it's just, that's not. I'm not saying that's the healthy way to do things. No, I know
what you're saying. I mean, it's just like we've gotten so terribly risk averse. I mean, just think about even right? I understand this really pretty well. I understand ventilation. I understand air. I understand risk. I understand when I should maybe double mask or maybe not, and I really feel pretty comfortable that I'm well versed in this, but just taking your mask off and being in a room with other people has gotten weird. It's like you realize now that you're breathing air that other people have breathed out.
I know.
And if I'm slightly thinking about that and I'm really comfortable, it's really okay. Like my body is strong, my immune system is strong. I've had the disease and been vaccinated. I'm good to go intellectually. emotionally.
Yeah.
It's like, it's a lot to process because we never thought about it before. And now that's all we've talked about for a year.
I know.
So
Yes.
I can understand where the anxiety is coming from.
Well, I walked into Costco the other day. I told you just before it came on, and I forgot to put my mask on. And when I realized I was in the store without the mask on, even like I feel like it doesn't. I shouldn't say this. I'm past all worrying about it, but I didn't have the mask on for the first time in public. I kind of went into a panic mode. Like I'm more worried about other people. Listen, right. And that's, I think a lot of people have taken the attitude. Listen, I'm not really worried about it now, but out of respect for other people, I need to have that mask on. So. Let me ask you, we were talking about this too before we started. So I saw a news show and they were talking about Biden started a commission or whatever we call it, group of people to look into where the virus started. So why is that important for us to know that?
Well, I think, every time we have a pandemic and a new virus emerges, we really want to understand where it comes from. And I don't think that this is unusual at all. I think that we also love conspiracy theories. Yeah. They're just interesting to think about. But the whole question as to whether or not it came from a lab, do I know? And like we were talking about before, it's really difficult to prove a negative. In order to prove that it did not come from the lab, we almost need to go and find the animal or the wildlife farm, or maybe it happened in two different places, maybe one in China and one elsewhere. In Southeast Asia, or not even in Asia, maybe in Africa. We don't really know 100%. We need to find the smoking gun somewhere in order to prove that it wasn't a lab. So when I was listening, there's a couple people who are doing podcasts on This Week in Virology. If you really want to listen to people who actually went to China and are pursuing this investigation, you can listen to 3 scientists on This Week in Virology. And they just recorded last week, I think on the 26th as well. So it's a podcast, it's on Spotify. And if you're out for a walk for a couple hours, take a listen because it's fascinating. And you can hear how scientists work and think and how like sequential they go through the 4 different emergence theories. And I can't say anything really more about that other than it's reasonable to be looking into this. I think we should. I think that the most interesting things that we need to keep sampling are all of these maybe blood samples that have been stored elsewhere. Take them out and go looking for evidence of people who had some immunity long before. I think from what I heard just before we were talking, somewhere back in October, November, it was looking like possibly there could have been some very low level circulation, possibly in China, of a pneumonia caused by SARS-CoV-2. But the thing to remember, like if you keep panning out, which is what I feel like we have this myopic little focus. If you keep stepping back further and further, you realize pneumonia kills a lot of people every year. And to think that, pneumonia was circulating caused by this novel coronavirus before December of 2019, I think is a very reasonable thing. When I first heard about a new, virus causing pneumonia, I'm like, well, of course there is. Like pneumonia is one of the #1 killers of kids and even adults around the world. It's viral and it's bacterial. So this is a fact of life. We're going to have viruses that cause us to have pneumonia.
And so if they, let's say, as big F here, if they find out that it came from a lab, it was man-made, what do we do about it anyways?
I guess that's a good question. I mean, what does that tell us? I think it tells us that we need to think carefully about who our allies are working on, viruses. People are working on viruses. It's responsible work. It's interesting work. They're careful. It's vital work to figure out how they work. It's absolutely fascinating. But I think that we want to have really close working relationships. And I think one of the points that these researchers make is that the more we poke at China and the more we undermine credibility of the director of this lab, the less likely it is we're going to have a good collaborative relationship and be able to keep tabs on things. And I think that's just human to human, scientist to scientist. That's important.
And I heard somebody else get on, and they kind of, when I was listening to them talk at first, was really, but they were saying that if you think about it, once China knew that the virus was out there in their country, there's really no incentive for them to try to contain it. In fact, if their economy was going to get hurt by this virus, they didn't want just their economy to get hurt, and then their country is all left behind. They let it go freely around the world so that the world's economy was hurt by it. Now, I don't know, it kind of made sense to me when he said that, and I guess from a political standpoint, you could see China thinking that way. I'm not saying that they did. I'm not saying that I agree with it totally, but it's not out of the realm of possibility, don't you think?
I think it would have been impossible to keep a virus like this from getting out.
Yeah.
I mean, it's just, you look at how infectious it is before you develop symptoms. And, now we're fairly certain that it can also spread via aerosol. I saw how it spread personally in a group in a room that was not well vented. I mean, it's just absolutely inconceivable that a strict enough lockdown could have kept it into one place. And that's one of the problems I have with a severe and strict lockdown that's gone on and that did go on for so long, because there are collateral damages from doing it that way. And, the scrutiny and the focus and the hyper focus on whether or not schools can open and how they open, that level of dialogue should have been applied to the nursing homes, where our most vulnerable, 8,000 times more likely to die.
Yeah.
I mean, early on in the pandemic, people were talking about that. Public health professionals, friends of mine, were screaming to get the Post, the Times, the Washington Post, somebody to publish these innovative ideas that they had for bringing more staff in to really help protect the most vulnerable people in the nursing homes. And no one was listening. So I really have a trouble with that.
Yeah, I agree with you. Okay, so if we were to do it again, the nursing homes would have been the main focus. Those are the people most at risk. The schools, in your mind, I put you on the spot here, but in the schools, you think they should have stayed open then?
Well, I think other people say that too. I think even CDC Director Walensky has said that schools should be the last to close and the first to open. So I think, and there are many nations with good examples of schools remaining open the whole time. Some of them with kids not masked under age 12, and others with everyone masking. In Japan, it's culturally a lot more feasible to get everyone to mask. So, our article was picked on a little bit because of the one radical thing that we said, which is, we actually believe it's safe enough for kids to go to school unmasked. We believe that the science says that. Whether or not people are ready to hear that, are able to do that, is another matter entirely. And the nuance needs to come out in conversations like this regarding, okay, who's really nervous, who's really at high risk, who's really reticent to come back to a school where people aren't masking. So taking masks off may not be the right thing to do, but it's not because of the virus. It's because of the fear that's been instilled and incubated for so long, such that people are really nervous. And so I think a stance of compassion and understanding and good communication and collaboration now through school, like the runway of this summer, to talk about that is absolutely vital to get the kids into school who need it the most. Because all of us talking in the Twitter sphere and with access to internet and conversations like this are really not the ones whose kids need school the most. We've just driven a wedge between the haves and the have-nots that's, I think, really terribly, terribly unfortunate with the pandemic response. And I guess, we're trying to say, hey, we need to be honest about this. We're going to wave the white flag of reason that a lot of people in this country have. There's a lot of reasonable people from both sides of the political spectrum saying, yeah, it's probably okay. It's probably fine to move forward, but it's that we're getting friendly fire from one side or the other for trying to strike a middle ground and bring people together in the interest of the children. It's unfortunate that path of reason and truth is being undermined from the sides of political continuum, not a scientific one. What we're saying is apolitical. It's not political. It's scientific only. But because of the wedge that we've driven between people over public policy, it's really become very difficult to talk about science without politics becoming involved.
No kidding. So we were told over and over, especially at the start of the pandemic, that one of the reasons for masks and shutting things down was that if it continued like this, the healthcare system was just going to get run over. And they told all the story about all the people in the hospital and the ventilators, and people dying in the hospital by themselves. Do you think that was going to happen anyways? At the rate it happened?
I don't think so.
I should ask the question better. You think that would happen anyways at that rate if we didn't take the steps that we did and shut things down and put the masks on? If we just said,
did the response do anything to help?
Yeah, right.
That's a good question. I think it did. I personally am in the camp where I don't think masks can hurt. I think that in some cases they don't do much. Like in my case, in the right situation, a mask can really not do much for you. When worn properly with good fit and filtration or double masking, if you're in a really densely compacted environment, yes, it can help. I think that 40% of the deaths were among nursing home residents. If you look at the epidemiology of the deaths, and sometimes even I forget that it's not all just from people having random household exposures or workplace exposures. It's actually been many of the deaths have been among the highest risk and due to age and due to living in a congregate setting where the virus spread super fast. So I think we could have done more to prevent deaths by focusing on the places where people were at highest risk and essentially, just to speak freely and plainly, kind of trapped. Like you're a nursing home resident, you're not highly mobile, you're in your room, maybe or maybe not, you're able to open your window. Maybe you can't even open your own window. And there was no vaccine available. Even now, the uptake of vaccination among some healthcare professionals is not quite where we would want it to be. And so I think really, if we were to go looking for more bang for our public health policy buck, it would have been focusing on the places where the greatest concentration of the most vulnerable people really were. And that was in nursing homes and other, residential facilities for people at high risk.
I can't remember too. I think it's Cuomo in the state of New York, the governor. I think he was sending more people to the nursing homes, like more patients to it at first. There's some big deal with that too.
Yeah, there's some brouhaha about that. I honestly haven't been tracking that too fast because I think it's another matter of, people dogpiling on, a decision that was maybe not so great and making it look even worse than it actually was, or maybe it was really bad. I just, my co-authors and I are, as mothers, as scientists, and they're all doctors, we just really want to focus on what do we know now and what is safe for the kids to do and help people like recontextualize their world, because we've been living in this like place of fear for 17 months. And our big concern is that we're measuring everything under the sun about the virus. Like we've got dashboards everywhere related to the virus. We don't have mental health dashboards. Yeah. We don't have a way of really understanding what the kids are saying and feeling. And it's this like qualitative stuff that I was getting at, like the kids, when they go to school, I don't think I finished my thought before, but when you go to school, say you're going to school, it's great that you're going to school, but it's not in the school you knew. It's like your desks are all like partitioned. There's tape on the floors. There's no lockers. The lunch is different. You can't talk to your friends. You go to this other room if you have 20 minutes, but you can't talk because we don't want the virus to spread. And, we're worried that it's going to spread by talking. But, really, really, if we keep looking at modeling data, we keep looking at air circulation data, we look at the kids' noses, we look at whether or not the virus grows out of, the samples that we retrieve from their nose, like, it really is pretty safe. It's really not the highest risk thing that they're doing. The highest risk thing for the kids now is their mental health.
Yeah. And will we ever, like, I remember after 9/11, I thought, well, will things ever be the same again? And people lost their lives, loved ones lost loved ones. So that'll never change for them. But eventually we've moved on. I mean, it's coming up to 20 years, anniversary's coming up here. But we moved on and life goes on. For most people, like as it was before. But with this, you kind of wonder, like, man, will people be changed forever? Will the kids be changed forever? The way they look at life, the way they, want to go and try new things, and live a full life. Are they now always going to think to themselves, I need to be careful all the time here?
From talking to me for 6 months now, or however long, I'm an optimist, and I think people are inherently strong and resilient. And I really think that parents have unique challenges here to stay optimistic and stay strong and model that for their children. And I think that their children will watch how their parents recover from this. Yeah. And I think parents should really know, kind of like I keep saying in your show, Tom, that we need to trust our immune systems, just like you've been saying. Yeah. Parents should trust in their own resilience, and they should begin to take the actions if they can, if they believe the data, and if they're willing to kind of watch and, begin moving back toward normalcy. The kids will follow. I think the kids will be fine. I think that we have to be careful as adults to not lay too much of our frustrations and talk out loud too much, or, shape the child's mindset. I think we do need to be careful about that.
And
And
please,
again, it
please,
just gets to, what's that?
and let's live a healthy lifestyle too. Like get out and
Yeah.
exercise, eat healthy food. I mean, for me, I'm actually last week when you were not on, I had a gentleman on that's with that company that has gone to the insurance companies. The food is medicine,
Right.
they call it. And I just, man, if you want to, like, for your overall mental health and physical health, change your people that are overweight, they're not getting out and exercising. You can really, it's interesting you brought this up because I think you really then, that whole negative lifestyle and worrying about everything, if you know you're healthier and your body is better at fighting off viruses and all kinds of things, look into it, do your own homework, get healthy foods. It was really interesting talking to him about it because we've touched on this before about the cost of eating healthier and can you do it? And you did your own research yourself, and yes, you can do it. But this is even better. Like people that have obesity really need to change their lifestyle, particularly with type 2 diabetes. This healthy eating, it's more and more research. It was amazing how you can really reverse the diabetes, right? And go back to, so you don't have to take any medicine really. In fact, I saw one video with this guy, this Dr. I can't believe it's Chang up in Toronto. And I listen to a lot of his videos. He talks about fasting, but he also talked about how all the medication that people are taking for diabetes, how it really helps, somewhat helps control the disease, but it makes it even worse in some ways because you're putting on more weight and you're getting less healthy, right? So now that just feeds into diabetes anymore. So it was really interesting to listen to him talk about it. But
no, I agree. I mean, we need to just do the basics. Get out and move if you can. A lot of people have work from home, and other people have jobs outside, and can actually use their bodies during their day. Really quite envious of those folks because they probably live healthier.
Okay, so here's the big topic we have to cover before we end the show. Our pull-up competition, or not competition we're having, pull-up updates. Where you at?
It's so difficult when you say pull-ups because, my children are teenagers now, but I can't stop thinking about pull-up diapers. So I wonder when I will be able to get that out of my mind. That's right. Talk about PTSD, right? It's diaper changing.
Yeah. So where you at? You were at three 2 weeks ago, weren't you? Were you at 3?
I was at 3 2 weeks ago, but I must confess we had a visitor and we did try some Southern food down here, and it's been nothing but insane Southern, incredibly delicious cooking, garlic knots that are as big as your head and stuff like that. I really tried to behave, but I took a week off of the pull-up competition, so I'm going to have to get back into a healthy lifestyle.
and your sons then, weren't they? They were doing pull-ups with hockey equipment on and without hockey equipment on, correct?
Yes. And so we have hockey tonight. We have pond hockey tonight, so it's 4-on-4.
Oh, nice.
And so, I like 4-on-4. It's a lot of fun.
Oh, totally. And you say pond hockey, what do you mean? It's just...
Well, that's what we call it. We call it pond hockey. But
just open. There's no referees or anything. Just going out and playing.
Actually, there are referees. And you know what? These crazy kids, the poor refs, they can't tell who's been out too long. Like the kids love the hockey so much that they won't come off the ice. And the other guys on the bench are like, come on, they can't get them off.
No coaches?
No, it's just, refs on there. And then it's like a penalty shot instead of in the penalty box. It's a lot of fun.
That is fantastic for the kids. I think they learn more about the game that way. So, coaches dedicate so much time. So I'm not being critical of coaches, and their job is to coach out there. But sometimes it's so good for the kids just to go play and figure it out for themselves too, right? Like I was when I was lucky, played with Wayne Gretzky, Phil Esposito, all these great players, and I was the same way. We all played on ponds, and no referees, no parents, nothing. Just like 10 guys, you throw your sticks in the middle, throw them to each side, and you go play. And you play for hours, and you figure things out all by yourself, and you learn the passion for the game, and I think you learn the game as well while you're doing that. So,
hey, I have a question for you, and maybe we can come back to this next week because I know the Grasshoppers need to go and time's up. But so hockey is a really strategic game, a very fast-paced game, but I think it's a very much a game of emotion and passion and mindset. So I've looked at some statistics a long time ago, like regarding the first goal scored and how much time into the first period and what that means for the outcome of the game. So like if you get a goal scored against you, let's just say like I score against you, Tom, within like 2 minutes of the game, that kind of rattles your cage, right? Your team's cage a bit. And so it's a little bit harder to come back from that, would you say?
Yes, you go in with the game plan. And then the trick is in the really good teams, if they get scored on, they don't change their game plan. They realize they've got faith in the process. They've done it before. They trust their coach. They trust their teammates. And they say to themselves, okay, don't change. Now we still got, if it's the first 2 minutes you're scored against, you still got 58 minutes now to get back in the game. If you change your game and go away from what you've strategized for, that's, I think, that's why teams get in trouble when they do go down a goal. The good teams are the ones that say, don't change anything. We're fine. We got lots of time here. We believe in our strategy. We believe in everything. So I think that's the reason why. And it's more like in the NHL, obviously it's tougher with kids, but the NHL, I think the teams that have a few more veterans on the team too, that are leaders that step up and say, don't change everything. Like on the bench right away, they're saying, keep going, guys. Just keep going with your game plan. But
interesting. I really feel like that comes full circle back to what we've been talking about with, like, the article in the Post and the trying to focus on data and the game plan. It's about the game plan.
Yeah.
And I guess we mothers are saying, we trust the game plan. We trust the data. We trust that there's no such thing as zero risk, but we have to be mindful of all of the other problems we're going to cause if we continue down the path we're on. It's time to stick to the game plan and start charting a path forward and trust in that data and that science.
Right. And like you said, there's no such thing as zero risk prior to this pandemic either, right? I mean, to living in the world and doing things, you take on risks. That is part of it. You're going to get hurt. I was talking to somebody the other day and we were joking around. They saw a scar on my stomach and a scar on my shoulder, and my one wrist is sideways kind of.
And the one wrist you didn't even know you broke, right? I told the boys about that.
Yeah. So it's, I look back, but I wouldn't have changed my life at all. I've had a fantastic life. I wouldn't say, like my poor mother, she's not with us any longer, but I think I told you a story where she made me wear this mouth guard all the time. And I was begging her to take it off, I took it off. First game, I got hit in the tooth, so that's why I've got fake teeth up front here. So, but like I said, I've had a fantastic life and some of the great things I've done, the people I've met, places I've gone, but I took risks and got hurt, and you realize, okay, you're going to get hurt. Mentally, you'll get hurt. Physically, you'll get hurt. Emotionally, you'll get hurt, but you'll recover.
Yeah.
Definitely.
Yeah. Resilience. I think we learn from the hard times, and you can always, even if we feel like we're in a place where we're still nervous and still anxious and stuff, tomorrow's a new day. We can resolve to say, hey, you know what? I think this path of optimism and this path of believing in the data is possible. Right. Let's start thinking about whether or not it's possible to move forward and, give the kids their lives back. And certainly outside, for those who are really nervous, certainly outside is a very safe place to be.
Right. So you're right. And parents, you got to lead the way. You made a great point there. The parents in the home have got to be positive, turn the news off when all this bad news is coming on, get outside with the kids, play catch, go for a walk, do whatever you want to do, ride bikes, go for a hike, do whatever, and get back to a normal life. I agree.
Yeah.
Good job, Tate. That's an excellent show there. Very informative. That's good. I like that.
Oh, I hope so. I hope grasshoppers ask questions and things, because I feel like I went off on some tangents and maybe didn't actually ask things or answer things as well as I could have.
No, you're great. You're a fan. You always are. Yes, you doubt yourself too much. We're going to have a show dedicated just to stopping you doubting yourself. All right. So now
I think humility is a good thing. I have not all the answers. I just, the thing that I keep coming away from, and I think it would be true for all reasonable people in kitchens across America, is, if your gut says something, maybe pay attention to it and trust yourself and take care of yourself and help your neighbor and help your children. And you're probably right about some of this, so listen to your gut a little bit.
I've learned in my life that when my gut and my heart tells me something, I do it, and I know full well that I'm going to make mistakes. I'm going to screw up. Bad things are going to happen, but you've got to follow your heart. And if something bad happens, and I think I think you have to look and say, you know what? I will make mistakes. Life is not fair. Things are not always going to go my way. And when you've already accepted that, when those bad things happen, then you just get up and get going again. Because you knew the mistakes were going to come. Nobody's going to be perfect.
No one's going to be perfect. And it's not like we're, encouraging throwing caution to the wind or being reckless. I mean, absolutely not. There's just, you cannot create a perfect bubble. Yeah. And I think that, early in the pandemic, there was a desire to create sort of a bubble to navigate through. And now I think we've all come to our senses that the virus is here to stay, but thankfully we have vaccines, and we need to focus more on the fact that those have brought the risk down tremendously. Yes. And it's okay to start thinking about moving forward again.
And I agree with you. The vaccines are fantastic, but also be your own vaccine machine, right? I mean, get out and be healthy. By being healthy, getting your weight down, exercising, eating good foods. Again, I'm not saying don't get vaccines, but you can help yourself by getting yourself healthy too. So
you can, in fact, even for those who are overweight, and I would say based on the last data that I looked at, 3 out of 4 of us are overweight. The British Journal of Sports Medicine, we've talked about this before, Tom, said 150 minutes a week seemed to be fairly protective for people, even if they were overweight. So just start moving. That does a world of good for hypertension, for diabetes, for metabolism, for mental health. Moving is so important.
And don't have some built-in excuses too. And it's easy, right? Because people say, "Oh, well, I don't have time in the day or whatever. I don't have the right period." Walking, get up earlier, get up 30 minutes earlier and go for a walk. There's no excuse. And once you do it, you're going to start feeling great about yourself too. So it's not like it's drudgery. It's not like it's some chore.
No, and I think it's about replacement, right? Like so what time of day, like, do you just kind of surf on Facebook or whatever, right? So take that 40 minutes and actually just go walking while you're doing that.
Totally. Or if it's a matter of you don't have time in the morning and you want to do it in the morning, well, don't be sitting watching TV all night, like till midnight, and then you got to sleep till 7 o'clock or whatever it is. Go to bed an hour earlier and then tack that hour onto your day at the other end. So now you got an hour in the morning. What was it? The native?
Or if you love TV, maybe Tom, you could demonstrate some plyometrics. Using your own body weight. So watch TV in plank position, or be doing squats, or get some hand weights, or get those TheraBands.
Yes, I got the bands. Yeah, I got the bands at the start of the pandemic. I got those. Right? Yeah.
Yeah. So watch all the TV you want, but not on the couch.
Yeah. Get off the couch. Great point. Get off the couch, move around. You know what? You're right. Even if you're in the house, instead of sitting at the desk all the time, get yourself one of those big medicine balls and sit in the medicine ball. So you're working on your core while you're sitting there. There's so many things you can do. Once you get into doing it, you really feel good about yourself. And again, try not to train your mind to look at, I enjoy this. Don't look at it like, oh, I got to work out. It's like, switch the gears there. Start thinking, I love this. This makes me feel great. I'm in better shape. And for you,
I have to tell you one last little thing before I know you want to hang up on me, Tom.
I have one more thing for you first before you go. So what I want is every morning I'm going to text you now, and I want you to stand in front of the mirror for 5 minutes and tell yourself how great you are. Okay.
5 minutes is a long time, Tom.
All right, you can go start by 2 then.
That's a.
I am great.
So maybe,
I am great. Allison, you are great. Talk to yourself.
One of the other really cute hockey moms, I just love her. Her name is Katie. She moved from Ohio. The family moved here during the pandemic. They had some tough times, and they've just got the kids involved in hockey and getting new jobs. She works like 3 different jobs for nonprofits. She's just amazing, just a lovely person. And she and I are out doing push-ups and weird stuff in the parking lot before hockey practice.
Nice.
Between cars. So one of the kids was looking for me, and it was dark, and how are you going to find your mom in a parking lot, right, when it's dark? But I was over doing push-ups, and my younger one, Ben, was like, "Yep, that's mom." I found her right away. She's hiding between the cars.
Yeah, see, and that should become like a normal thing that people are doing. That it shouldn't be like, "What the heck's she doing?" Like she's crazy.
Complete wacko.
Yeah, that should be a normal thing. Like everybody should be doing push-ups. You stand around.
I love it. Little Katie is so cute. She's so much fun. And she's like, yeah, sure. She was in her flip-flops and her nice clothes, whereas I'm always dressed badly, ready for parking lot push-ups anytime. And then she's like, sure, no problem. Let me put down my dinner and I'll come do push-ups between cars with you.
Nice. I like that. That's good. Take a video of that next time. I want to see you guys doing that. That's good.
Okay.
All right, great show. Thanks, Allie. See you, everybody.